surrounding environment is very important for a therapeutic therapy session. If a handler assists, ensure the horse is not held at attention like it is for a farrier or a vet. The handler needs only to ask the horse not to move its front feet if it wants to. We want the horse to be able to turn its head around to see us and participate during the session. If you are on your own, mock tie the horse so if it needs to move away or suddenly takes up the slack on the lead, it's not secured. It can slide through. Do not cross tie a horse for a therapeutic session. It does not have freedom of its head to give you feedback. Before touching the horse, relax yourself. Breathe deeply a couple of times. Have foremost in your thinking that you're intending to assist the animal and want their feedback and participation for an effective session. Look for signs of acceptance to enter the horse's electromagnetic field and then touch the neck or the shoulder first. Let the horse sniff your hand or your red light if that's what you're going to use. Begin under the front of the eye and continue smoothly up the head, flattening the ear, keeping the fingertips in touch with the neck, then using both hands on down the top side of the neck, over the cervical rhomboid muscles, above the dorsal scapula, and then increase the area covered using both full open but relaxed hands along the back from the wither pockets, keeping above the shelf of the ribs. On reaching the hindquarters, place a check on with a loose fist above the stifle as a safety measure. Flatten the other hand widely to cover the large area of the rump where the meridian passes. Allow the fingertips to fall into the crease of the racing line division between two hamstring muscles and follow the rear groove down the hind leg, through the hock joint, between the suspensory ligament and the tendons of the lower leg, and on to finish 1/3 of the distance of the side of the hoof from the heel. Run the bladder meridian 3 times on each side of the horse. The third time, go a little slower between the areas of the scapula and the hip where the saddle sits, as this is where there may be reactions from the horse to guide you to problem areas during the session. After the 3 runs, your horse may need to shift about a little to get comfortable. Once settled, this is a good time to feel the horse gently all over, to feel for temperature changes, new cuts, scratches, lumps and bumps which may need attention. Check the foreleg digital pulse at this time also. If full and throbbing, a vet should be called. After the therapy session, run down the bladder line once each side fairly briskly to complete and close the session. This reminds the horse to wake up a little and regain their instinctive awareness when they go out in the field with other horses. If the horse is in a deep and relaxed pose, place them loose in a stall or a yard whilst they are processing the changes so that they can rest. Horses become trained to this opening procedure and recognise they're about to have a therapeutic health session rather than to be groomed or saddled or shod. Once relaxed like this, your therapy will be far more effective.